Are you tired of feeling like your medications might be silently robbing your body of the nutrients it needs to thrive? You're not alone. Today, I'm Dr. John DeMarco, and I want to share something that affects millions of Americans over 50, but gets very little attention from the medical community. If you've been wondering why you still feel exhausted despite taking your prescribed medications, or why certain symptoms persist even when you're following your doctor's orders, the answer might be hiding in plain sight. Your medications may be depleting critical nutrients like B12, magnesium, and CoQ10 from your body. By the end of this video, you'll understand exactly which common medications are affecting your nutrient levels, why this happens, and most importantly, what you can do about it. I'll share specific, actionable steps backed by peer-reviewed research that you can discuss with your healthcare provider. Let's start with something that might surprise you. Did you know that over 60 of Americans over 65 take at least 3 prescription medications daily? What most people don't realize is that these same medications that are helping manage their conditions might be creating entirely new health challenges. Here's what's happening. When we take medications, especially long-term, many of them interfere with how our bodies absorb, store, or use essential nutrients. This isn't a side effect that gets discussed during your typical doctor visit, but it's something that can significantly impact your energy levels, bone health, cognitive function, and overall quality of life. Think about it this way. Your body is like a finely tuned machine, and nutrients are the fuel that keeps everything running smoothly. When medications disrupt this process, you might experience fatigue, muscle weakness, memory problems, or even increased risk of fractures without ever connecting these symptoms to your prescriptions. Let me share what recent research from the U.S. Pharmacist Journal in 2019 and a comprehensive study published in PMC in 2021 have revealed about this widespread issue. The evidence is clear. Common medications are creating nutrient deficiencies that are often overlooked and undertreated. Let's dive into the specific medications that are most likely affecting your nutrient levels. I'm going to break this down into clear categories so you can easily identify if any of your current medications might be impacting your health. First, let's talk about proton pump inhibitors, or PPIs. These include medications like omeprazole, lansoprazole, and pantoprazole. If you're taking these for acid reflux or stomach ulcers, you need to pay attention to this. According to research from PBA Health published in 2024, PPIs work by dramatically reducing stomach acid production. Here's the problem. Stomach acid is essential for absorbing vitamin B12 from food. When you reduce stomach acid, you're essentially blocking your body's ability to extract this crucial nutrient from your meals. Additionally, PPIs increase the excretion of magnesium through your kidneys, which can lead to dangerously low magnesium levels over time. The symptoms of B12 deficiency include fatigue, weakness, memory problems, and even numbness in hands and feet. Magnesium deficiency can cause muscle cramps, irregular heartbeat, and bone weakness. If you've been on PPIs for months or years, these nutrients deserve immediate attention. Next, let's discuss statins. These cholesterol-lowering medications like atorvastatin, simvastatin, and rosuvastatin are among the most commonly prescribed drugs in America. While they're effective at reducing cholesterol, they also significantly lower your CoQ10 levels. CoQ10 is absolutely essential for energy production in every cell of your body, especially your heart muscle. When statin medications block cholesterol production, they also block CoQ10 synthesis because both substances are made through the same pathway in your body. This is why many people on statins experience muscle pain, fatigue, and weakness. A study published in the Journal of the American College of Cardiology found that CoQ10 depletion from statin use can be substantial enough to affect heart function and energy levels. This is particularly concerning for older adults who may already have declining CoQ10 levels due to aging. Now, let's talk about metformin, the most commonly prescribed medication for type 2 diabetes. While metformin is generally well tolerated and effective for blood sugar control, it has a significant impact on vitamin B12 absorption. Research shows that metformin blocks B12 absorption in the small intestine, and this effect becomes more pronounced the longer you take the medication. What's particularly concerning is that B12 deficiency can actually worsen some diabetes complications. B12 is essential for nerve function, and deficiency can contribute to diabetic neuropathy, the nerve damage that affects many people with diabetes. This creates a situation where the medication helping your diabetes might be contributing to one of its most serious complications. Corticosteroids like prednisone present another significant concern. These medications are often prescribed for inflammatory conditions, but they dramatically affect how your body handles calcium and vitamin D. Corticosteroids decrease calcium absorption from your intestines while simultaneously increasing calcium excretion through your kidneys. This double hit can lead to accelerated bone loss, increasing your risk of osteoporosis and fractures. The research published in PMC in 2021 shows that elderly patients on corticosteroids have significantly higher rates of bone fractures compared to those not taking these medications. Let me also mention a few other medication classes that deserve your attention. Diuretics, commonly called water pills, can deplete potassium, magnesium, and other minerals. Antidepressants, particularly SSRIs, can affect folate levels. Beta blockers may impact CoQ10 levels, similar to statins. The key takeaway here is that if you're taking multiple medications, and most seniors are, the risk of nutrient depletion multiplies. You're not just dealing with one medication affecting one nutrient, you're potentially dealing with multiple pathways being disrupted simultaneously. Now, let's move into the solution phase. The good news is that once you understand these connections, you can take proactive steps to protect your nutritional status while still benefiting from your necessary medications. Your first step should always be to discuss this with your healthcare provider. I recommend scheduling an appointment specifically to review your medications and their potential nutritional impacts. Bring a list of all your medications, including over-the-counter drugs and supplements. Ask your doctor about ordering blood tests to check your B12, magnesium, vitamin D, and CoQ10 levels. For those on PPIs, consider asking your doctor about alternatives like H2 blockers, which may be less likely to interfere with nutrient absorption. If you must stay on PPIs, discuss B12 supplementation or even B12 injections, which bypass the absorption problems caused by low stomach acid. When it comes to dietary adjustments, focus on nutrient-dense foods that can help counteract medication-related depletions. For B12, include eggs, fish, meat, and fortified cereals in your diet. For magnesium, emphasize leafy green vegetables, nuts, seeds, and whole grains. Foods rich in CoQ10 include fatty fish, organ meats, and whole grains. However, dietary changes alone may not be sufficient if you're dealing with significant medication-induced depletion. This is where strategic supplementation becomes important, but it must be done under medical supervision. For B12 deficiency caused by PPIs or metformin, sublingual B12 tablets or B12 injections are often more effective than standard oral supplements. The sublingual form dissolves under your tongue and can be absorbed directly into your bloodstream, bypassing the digestive issues caused by these medications. For magnesium supplementation, magnesium glycinate is often the preferred form because it's well absorbed and less likely to cause digestive upset compared to magnesium oxide. Most adults need 4,004 milliliters of magnesium daily, but your doctor can determine the right dose based on your blood levels and symptoms. CoQ10 supplementation is particularly important for statin users. The typical dose ranges from 1,200 milliliters daily, but this should be discussed with your healthcare provider. CoQ10 can be expensive, but given its importance for heart health and energy production, it's often worth the investment for those on statin therapy. Here's something crucial to understand. Timing matters when it comes to supplements and medications. Some supplements can interfere with medication absorption if taken at the same time. For example, calcium can interfere with certain antibiotics, and iron can affect thyroid medication absorption. Work with your pharmacist to understand the best timing for your supplements. Many people find success by taking their medications with breakfast and their supplements with dinner, but this varies depending on your specific situation. Let me address some common concerns I hear from patients. First, some people worry about taking too many pills. I understand this concern, but consider this. Would you rather take a few targeted supplements or deal with the long-term consequences of nutrient deficiencies like fractures, neuropathy, or severe fatigue? Second, cost is often a concern. While supplements do represent an additional expense, the cost of treating nutrient deficiency-related health problems far exceeds the cost of prevention. A bottle of B12 supplements might cost $15 and last 3 months, while treating B12 deficiency neuropathy could cost thousands. Third, some people question whether supplements are necessary if they eat a healthy diet. While good nutrition is always important, medication-induced nutrient depletion often can't be overcome through diet alone. The mechanisms involved actually block absorption or increase excretion, so even with perfect nutrition, you might still become deficient. Let me share a case study that illustrates these principles. I had a 75-year-old patient who came to me complaining of severe fatigue, weakness, and difficulty concentrating. She'd been to multiple doctors who couldn't find anything wrong. When I reviewed her medications, I discovered she'd been taking omeprazole for acid reflux and Metformin for diabetes for over 5 years. I ordered blood tests that revealed severe B12 deficiency and low magnesium levels. Within 6 weeks of starting B12 injections and magnesium supplementation, her energy returned, her brain fog cleared, and she felt like herself again. The transformation was dramatic, and it could have been prevented if someone had recognized the connection between her medications and her symptoms years earlier. This case illustrates why it's so important to be proactive about monitoring your nutritional status when you're on long-term medications. Don't wait until you develop symptoms. Prevention is always better than treatment. Now, let's talk about some mistakes to avoid. First, don't start supplementing without proper testing. You need to know your baseline levels before you begin, and you need to monitor your progress. Some nutrients can be toxic in high doses, so more isn't always better. Second, don't assume that generic multivitamins will solve medication-induced deficiencies. The amounts of nutrients in most multivitamins are too low to address significant depletions, and the forms of nutrients may not be well absorbed. Third, don't stop taking your prescribed medications without consulting your doctor, even if you're concerned about nutrient depletion. The benefits of properly managed medications typically outweigh the risks of nutrient depletion, especially when you're actively addressing the nutritional issues. Fourth, don't ignore symptoms that might be related to nutrient deficiencies. Fatigue, weakness, memory problems, muscle cramps, and mood changes can all be signs of medication-induced nutrient depletion. Document these symptoms and discuss them with your healthcare provider. Let me also address the importance of regular monitoring. If you're on medications that affect nutrient levels, you should have your nutritional status checked at least annually, and more frequently if you're experiencing symptoms or if you're on multiple medications. your doctor can order simple blood tests to check B12, magnesium, vitamin D, and other nutrients. Many insurance plans cover these tests, especially if you're experiencing symptoms that might be related to deficiencies. Here's something else to consider. Some symptoms attributed to normal aging might actually be related to medication-induced nutrient deficiencies. Don't accept fatigue, weakness, or memory problems as inevitable parts of getting older without exploring whether your medications might be contributing to these issues. The research is clear that addressing medication-induced nutrient depletion can significantly improve quality of life for many people. In studies of elderly patients, those who received appropriate supplementation for medication-induced deficiencies showed improvements in energy levels, cognitive function, and overall well-being. As we wrap up, let me summarize the key points you need to remember. First, common medications like PPIs, statins, and Metformin can significantly deplete important nutrients like B12, magnesium, and CoQ10. This isn't a rare side effect, it's a predictable consequence of how these medications work in your body. Second, the symptoms of medication-induced nutrient depletion can be subtle and are often mistaken for other conditions or normal aging. Fatigue, weakness, memory problems, and muscle issues can all be signs that your medications are affecting your nutritional status. Third, both dietary changes and targeted supplementation can help address these deficiencies, but they need to be implemented thoughtfully and under medical supervision. The right approach depends on your specific medications, your symptoms, and your individual health status. Fourth, regular monitoring through blood tests is essential if you're on medications that affect nutrient levels. Don't wait until you develop symptoms. Proactive monitoring can prevent problems before they become serious. Finally, communication with your healthcare team is crucial. Make sure all your doctors know about all your medications and supplements. Your primary care doctor, specialists, and pharmacist should all be aware of your complete medication regimen so they can help you address potential interactions and deficiencies. Remember, you don't have to choose between managing your health conditions and maintaining optimal nutrition. With the right approach, you can do both. Your medications can continue to help manage your conditions while you take steps to protect your nutritional status. The key is knowledge and action. Now that you understand how your medications might be affecting your nutrient levels, you can advocate for yourself and take steps to optimize your health. Don't let medication-induced nutrient depletion rob you of the energy and vitality you deserve. I encourage you to schedule an appointment with your healthcare provider to discuss your medications and their potential nutritional impacts. Bring the information from this video, ask for appropriate testing, and work together to develop a plan that addresses any deficiencies you might have. Your health is worth investing in, and with the right approach, you can feel better, have more energy, and enjoy a higher quality of life, even while managing chronic conditions with medications. For additional resources about medication-induced nutrient depletion, including specific supplement recommendations and monitoring guidelines, be sure to check the description below. I've included links to the research studies I mentioned and additional information that can help you have productive conversations with your healthcare team. Thank you for watching. And remember, taking control of your health is one of the most important investments you can make. I'll see you in the next video where we'll continue exploring ways to optimize your health and vitality.